Breath in and breath out. Breath in and breath out. Feel that great peace within yourself, that beautiful truth, that beautiful radiant burst of light that resides safely and securely in the center of your being. It can never be extinguished. It is infinite and eternal. It is effervescent. It is effulgent. It is light itself. It is purity. Purity beyond doubt, beyond fear, beyond the glamour of too complete an understanding. It is beyond the intellect itself. It is a state of pure knowingness. That regarding the beholding of this state of being, you know the truth revealed. You know who you are. You know the consistent unfolding of the universe. You know its rhythms, its cycles, its sequences. And effortlessly, you are in that flow of all nature, where you are nature itself, experiencing the grandeur of all things uniquely, to behold the light and the beauty of all that is, to behold the grand orchestration of the universe and the way that it unfolds as it does, to behold and be in the natural order of all things, to flow with the five kingdoms, the mineral, the plant, the animal, the deva, the nature spirits, and the human beings. To feel how good and how pleasant it is to know this balance, to experience the unfolding effervescent light within yourself, and to know the truth revealed, where you cannot be shaken, where the truth is unafraid of questions. Feel the purity and the essence of this truth within yourself, and let it expand to any part of you that experiences doubt, fear, loss, any part of you that the ego tries to insist upon itself, and yet the ego is simply neutralized by the light. It is what you make it. You are whole. You are complete. There is no separation. And may the sweet principles of harmlessness and compassion be the ever constant, ever present guide of your every intention, of your every thought, and of your every action. And so it is, and so it shall be. It is done. Breath in gently and deeply, and breath out. Breath in gently and deeply, and breath out. Feeling composed, in perfect point of balance and content. And when you feel the moment is right, open your eyes.
Thank you, Dr. J.
You are welcome.
Thank you.
Are you ready to begin the slide set?
Oh, yeah.
Okay, let's begin. Somehow, we always figure out a way to occupy the same space at the same time, as is pictured here. There is a way to do it. You know, the Dalai Lama, he said, the more you're motivated by love, the more fearless and free your actions will be.
Mm.
Grant your blessing so that my mind may become one with the Dharma. Grant your blessing so the Dharma may go along the path. Grant your blessing so that the Dharma may clarify confusion. Grant your blessing so that confusion may dawn as wisdom.
Mm.
I just want to say a word about attachments.
Mm.
You know, this is part of two levels. Part one is more about tube attachments. And all attachments are a form of being possessed. Dr. Moriyama said that possession is more common than people think it is. Of course, if you, Tanya, were to speak to your family or your colleagues about being possessed, they would have a very different idea than what it really is.
Mm-hmm.
So part one is removing leeching energy from someone. Think of it as vampiric energy. A guy is vampirically leeching energy from his girlfriend, that kind of thing. Now, we call those tube attachments for ease of description. Part two, which is level 11, denotes removing intelligent forms of possession that may resist and or attempt to enter you. So without teaching you these two parts of being possessed, there's no point to teach spiritual healing, because the healer has to know what this is, what to do about it, and how to go about doing it.
Mm-hmm.
So both of these require your clearing and cleansing to be essential, and your complete focus. This is where it starts to get more and more real, Tanya. So part one, tube attachments, a form of possession. A tube attachment is a term that I like to use as an energy connection between you or a person and another person. It's easy to understand what a tube does, like a garden hose. Most are healthy. There's a lot of tube attachments, but some are unhealthy, and those are the ones that we focus on. You know, when you look at an acupuncture point, that's a nexus or a vortex of energy. But we need to be able to define, where do the tube attachments connect? They could be on an acupuncture point, they could be somewhere on the skin, they could be on a gland, an organ, a chakra. Of course, the astral dimension, you knew about that on level 1, the closest dimension to the physical, where there's no time or space, but there's still uniqueness. A causal dimension, which is the highest individuated dimension. These are the three dimensions, or the three yoga bodies that we talked about in level 1. The Purusha dimension, which is a dimension beyond self, it's also referred to as the dimension of divine beings. A chakra, which you know very well by now. Nadi or meridian. These are channels for the flow of chi, ki, orgone, mesmer, subtle energy that is not psi energy, but subtle energy. Nadi is a term used more by the Hindus, more by India, because they looked at it more like a spiritual thing. Meridian is a term used more by the Chinese, because they kind of went into it more from a bodily health type of thing. So there is no spoon. You know, you watch The Matrix, which now is this summer, will be 27 years since it came out.
Oh, wow.
And Neo sees the little girl bending spoons, and she says, "Do not try to bend the spoon because that's impossible." She says, "Instead, it is your mind that must bend. Only then you can realize the truth." And he says, "What truth?" And she says, "There is no spoon." So, but there's really no actual tube, but it is a form of attachment, and it's easy for you and I to imagine what a tube looks like. Everybody can kind of grasp that. It's just something that we can understand. And I give you a methodology how to remove the tube that helps your mind to understand what's going on and how it's happening, which all the time is continuing to awaken your spiritual focus. So you're helping remove the unhealthy attachments and possessions. The healthy ones, no need to do anything. And of course, it's not about you. More and more, as we go on through these levels, you must let go of yourself in the healing process. And it's ironic. Let's say you're standing at a table, you're working on someone laying on the table, and I say, "Well, it's not about you." And you say, well, yeah, but I'm the one standing here. So it doesn't seem to make sense, but it's not about you, but you're the one who is allowing yourself to be a vessel through which power flows. So what's happening is you're awakening the inner physician in you, but you're also awakening the inner physician in the individual. You are facilitating in them the divine blueprint for their spiritual awakening. That's what's really happening. It isn't just help me with my elbow. There's much, 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 much more to it than that. So we as healers let go of any personal investment or agenda, and that's hard. I've seen my students hug the person they were working on because they felt so much for them, and you have to be careful how much you get invested in the healing because you might take on something. And I've taken on many things. I've taken on many illnesses. I've taken on many karmas for thousands of people. I never stood up and put my hand up and said, "Me, I would like to do that." But sometimes that happens. Sometimes it happens to healers who have no intention of taking the energy on. They go, "Dr. J, what hit me?" I say, well, sometimes in our learning process, it is what happens. It's not good or bad. Then we emphasize our clearing and cleansing techniques. So we do our best to get out of the way. The best healers are the ones who get the most out of the way. You let the power flow through you, and you let go of personal investment as best you can. But you know, clearing and cleansing are absolutely crucial. You just have to emphasize, okay, I'm doing my as above, so below. I'm doing the heart-centered exercise. Okay, I'm done. Now I do the shower of little particles of light raining from a clear sky. And let go. I do all my clearing and cleansing exercises with very sharp focus and intent. But tube attachments, for the most part, are healthy and they're in the astral dimension. And we're concentrating on those that are unhealthy. So you're only looking, however you're looking. You might not be visual, you might be auditory, you might be kinesthetic, but the term looking means you're concentrating on just the ones that are unhealthy. And the trouble is, you're going to start seeing them. You'll start seeing them in people in the grocery store, when you're getting gas, when you're doing spiritual work. So you have to start making decisions as to, are you being called upon to work on that person, or is just something that you are observing? Because sometimes healers get into this trap where they feel like they got to work on everybody that comes along all the time.
Mm-hmm.
And that can really deplete the healer a lot quickly. So think of this methodology you're learning in levels 10 and 11 as another tool for your tool belt. Do you use all the tools all the time? No. You're going to take the wall plate off of your duplex outlet for your electricity. Well, you need a flat bladed screwdriver. You don't need a wrench. You don't need pliers. You know instantly what you need. So level 7, do I take them out of body? Nope, not needed. Okay. Use the tool that you need. You don't have to use everything. Are they possessed? No. Okay, move on. There are many, unfortunately, many vampiric attachments. All attachments result from fear of some kind.
Mm.
I will not be successful. I don't have enough power. I cannot do it on my own. I'm lonely. There's a million reasons why people are in fear. And these unhealthy attachments are vampiric. You, in your line of work, have probably seen this clearly. And it is a steady leaching of energy away from the person. Imagine someone comes to you and says, gee whiz, I don't feel so good. And you're seeing 15% of that person's energy being sucked away from them 24/7 all the time. And they become unhealthy, they're despondent, they can't get going, they don't have any energy. Now you're a healer and you observe this tube attachment going to someone, and it can really bother a healer.
Mm.
But instead of sucking blood, like, vampires need blood to live, right? So instead of sucking blood, tube attachments are sucking life force. So far more tube attachments are to women than to men. But that's changing. Excuse me, 1 second. Someone's knocking on my door.
Okay.
1 moment.
Mr. Nobody.
Okay, so there's usually far more tube attachments to women than to men, but that seems to be changing, but it's still mostly prevalent. And this includes something called sex magic, where the man attaches to the woman's second chakra for sexual manipulation.
Mm.
And it's very common. What can it cause? Tube attachments. Illnesses in the body, psychological and neurological disorders, mild to severe depression, forms of chronic fatigue. Tube attachments are a form of being possessed. What are the origins? Some tube attachments have been in place for many years. I worked on a woman in Canada who had a tube attachment that was there for over 20 years.
Oh my gosh.
And sometimes tube attachments will grow in size over time. They'll be like a small hose and then get to a bigger diameter. Let's say if there is such a thing as a diameter, but they'll get bigger and suck more energy.
Mm.
And sometimes they'll cause marks on the skin. I remember in a flower reading, I saw this tube attachment on someone, and I said, up here by your collarbone, you have a red spot. It's been there for a long time. I said, that's from a tube attachment, steadily taking energy away from you. So the end of the evening, the flower reading is over, and I asked who that was, and the woman says it's me. So she pulls her shirt aside like this, and here's this red spot,
Mm.
exactly where I said it was. So sometimes you are going to see things like that, that are physical marks on the body where these tube attachments originate, sucking energy. They can come from intimate relationships. They can be parental. They can be familial. They can be from the boss or from the employee. It can be in your workplace. They can be in your associations with others. So pretty much, it can be pretty much anything. It can even be from people in the astral dimension,
Really?
where an astral being can suck energy from you.
Mm.
So many sources. You remember how when you first came to ICT, you were already very strong in assessing a person's aura?
Mm-hmm.
Okay. So a lot of healers come to practice with native strengths, things you already have developed, things you're already strong. So continue to use the way that you access your assessment of tube attachments. If you do it through the aura, that's fine.
Mm.
But I would like you to get specific. Like Dr. J, I saw the tube attachment to the kidney. I saw the
Uh-oh.
tube attachment to the lumbar vertebrae. I saw
Mm.
the tube attachment to the upper left shoulder on the back,
Mm.
because I want you to continue to be accurate and precise rather than just general. This will hone your abilities in many ways beyond just what we're talking about here. And you are doing excellent. So I may demand a little more of you.
Mm.
So why? Why attachment? What's that all about? Most people are totally unaware of events that occur at the astral level. If you were to survey your family, your friends, your colleagues, your patients, and the general population, how many people are aware the astral dimension even exists as a real thing
Mm-hmm.
rather than something fanciful or mythological?
Right. You.
It's not a bad thing.
No, it's just what is.
It's just they don't know the mechanics of how spirit works,
Mm-hmm.
and you are. So nonetheless, negative attachments occur because of fears and perceived unfulfilled needs, like karma.
Mm.
So as you become aware of it, you see it. What you focus on becomes sharper, right?
Mm-hmm.
So even to the extent of taking energy from another person, maybe unknowingly, sometimes maybe inadvertently, but it's very sexy to get 12% energy for free from somebody else.
Mm.
It's very tempting. It's very alluring. Women do it to men too. You know, women who take advantage of their looks to get money from men, let's say, position, status, power. But it can also be a form of possession where they are
Mm.
taking energy from the man and he's actually becoming weaker as he's with this woman. And it can happen in just the reverse, the same way.
Mm.
And the thing is, Tanya, that as you go through your training, you're going to start to notice this
Mm.
from familial, parental, social, and sometimes it's good and sometimes it's a real pain to start noticing that this is really happening in your own backyard. And some spiritual leaders are really not spiritual leaders. They're in the business of collecting souls. And that is a dire form of manipulation that causes a tremendous amount of unnecessary suffering. So you have to be watchful of men and women who say they're a spiritual leader, but they're not. I knew a fella way back in the 90s who really misused his power with women. And, eventually he paid dearly for it.
Oh.
But he really hurt psychologically and energetically a lot of women. Because why? He was using sex magic.
Mm.
Now, methods. Tube attachments occurs mostly at an unconscious level in everybody. It's not something people, I think I'll just suck energy from that person. But the so-called tube is formed by the attachment to another individual. Again, it's a form of possession. Now, you see me repeating some of these terms for a reason so that it's just kind of repetitive and you get it.
Mm.
But it usually forms at a site that is vulnerable. Let's say an organ
Mm.
or a chakra. And usually it's only a small energy drain at first. But from then on, as I said, the tube can grow in size and can even migrate. It can even move. I've seen tubes that start, let's say, at the perineum of a woman. You know where the perineum is?
No.
It's between the anus and the vagina. It's where your legs
Oh,
meet your
okay.
body,
Mm.
right there at that
Mm.
crease. That's the perineum. I've seen tube attachments start at the perineum and then move up to, say, the level of the sacrum. Well, they're not necessarily fixed in place.
Oh.
Um, my observations and experiences, I have so many. Um, the ones that are the most compelling are the ones that are most obvious.
Mm.
So, for instance, the example of the woman that had the tube attachment with, that had the red spot on her upper part of her shoulder here. And of course, she pulls her shirt aside and there's the red spot there. And over 35 years of this work, I've seen many sites where there are physical remnants or physical indications of where the tube attachment is exiting the chi from the body.
Mm.
I've taken off tube attachments from people and they've noted very, very fast return to health or a positive change in their attitude or their
Mm.
demeanor.
Mm-hmm.
Um, over the last 5 years, I don't know that I've been looking for tube attachments as much as I have. I've gotten to the point where I can take off a tube attachment very quickly. I don't have to take my time anymore. It just seems to change as I change.
Mm.
But for now, when I teach you the methodology, please go through the steps one by one, and really get them and really take your time with them. Don't rush. Just really do every step very thoroughly so that you kind of get what we call muscle memory. You kind of get the way to do it, and then it becomes secondhand to you.
So let me ask you, I know you have a unique sense. I was just curious how the information is, how you're receiving it.
Okay. Um, well, I'm more visual than I am auditory. But if I see quote unquote a chakra, I don't always see the color. I see colorless color with no color. So if I see in quotes a tube attachment, I know that there's a form of energy being sucked away from that person to someone else. Now, that's a good question because I don't always see where it's going. Interestingly enough, when I take off the tube attachment, it's kind of like one of those automatic hose reels. Have you ever let go of something and it goes, blah, 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 you know, it kind of the reels all back up? That's happens a lot.
Hmm.
That the tube just kind of reels back to its owner, and of course now all of a sudden they think something's wrong. I'll give
Who,
you an
the
example.
other person?
I'll give you an example.
The
I'll give you
other
an example.
person thinks something's wrong?
Yeah, nothing wrong
Okay.
with examples. I'll give you an example. Okay. Um, how do I want to put this? I'm in Calgary and I'm doing an example for my healers. And I'll just say that I was working with this one person and all the healers are around me. And I take this tube attachment off of her, but I'm also teaching. I'm instructing, I'm not just doing it quietly. I'm saying, now I'm doing this, now I'm doing this, now I'm doing this. So they're watching me, right? And I take the tube attachment off and I'm almost done explaining. And 5, 10 minutes goes by and this woman's phone rings.
Hmm.
Who is it? It's her mother. And her mother says, "What's wrong, dear? Is something wrong? What's wrong?" So what happened was I took this tube attachment off of this woman, and within 10 minutes her mother called because the tube attachment was going to her mother.
Mm.
Her mother was sucking energy from her. I took the tube attachment off, and this mother calls, "Honey, what's wrong?" "Oh, you mother effer. You want to reestablish a tube attachment." Which is really good question. Now, if a baby is born to the mother, the baby cannot go back to the womb. So
Right.
when you take a tube attachment off of somebody, it can't reattach. It doesn't work that way. It's
Mm.
gone. But could the person then have another tube attachment? Well, yeah. I mean, if you were an alcoholic and stopped drinking and then decided a month later to start drinking, yeah, you could.
Right.
But a tube attachment can be a new one, but not the same one. Once that's done, that's done. That's it. It's gone.
Hmm.
So this woman's mother calls up and says, "Oh, I'm just checking in. Just want to see if everything's okay. Everything all right?" And you should have seen my student look around the room at me and all of our healers with her eyes as big as saucers that her mom would call right after this tube attachment is taken off. Now, remember, this is clinical. I'm talking to all the students step by step what's going on, how I'm taking this tube attachment off.
Right.
I'm going through this step by step, word by word.
Hmm.
Mother calls. Incredible. She knew.
She answered the question.
She knew. She knew on some level of her being that she was not taking energy from her daughter anymore.
Mm.
Now, what does the daughter do? Well, the daughter's going, "Holy crap, this shit works." Right? So now the daughter is more, I don't know how to put it. She's more on guard, I guess, or more aware.
Mm.
And when you're more aware, you're less likely to have something taken from you. You're kind of
Right.
watching your wallet a little more closely, I guess.
So our mind's going toward, I know you covered their healthy attachments and relationships. So the
Yeah.
question is, if I was present with her, would be, I know you saw this on the chakra or you saw it on the body, right? So the question is, did she feel this negative drain? I mean, evidently something's going on. She's there, right? Participating. She's a student. So
She's unaware that there was a tube attachment.
she was unaware. Interesting.
And remember, she's an ICT student. She's going through the training. And I'm doing this verbal exchange. Here we're doing this, here we're doing this, here we're doing this.
Mhm.
So I'm going very slowly so everybody can absorb what's going on. And then you should have seen the look on the students' faces because this woman was a fellow student with everybody. She's looking around at her fellow students like, That was my mother. So now the students are going, holy crap. Can you imagine if you're a student and you're in this situation and your fellow student's mother calls and your teacher is saying, okay, now I've taken off the tube attachment and within 10 minutes the mother calls?
Hmm.
What effect that would have on you as a student?
Oh yeah, you're like
It
affirmation for
would
sure. I
really
just
would
start.
it would
It's
really
just
make you want to pay more attention rather than
right,
thinking, oh, this is spiritual, couldn't possibly have anything to do with me. No, it has everything to do with you.
right. I think my mind is I'm already okay. So was this unhealthy attachment with her mom, and like you said, the vampiric uh, sucking of energy. So I was just curious if she knew she wasn't performing at 100%. If something was a little bit off.
I don't know. That's a
Well,
good
she's a
question.
student, so something. I mean, we're all drawn for a reason, right?
Yeah, it could be. I don't think we even got into that really. Like, did you notice you were operating at less efficiency than normal, or did you have things bothering you? We kind of just really got into the
Complicated.
discussion of the mother calling.
Right, right.
That's a good point.
Because it can happen and the other person doesn't know, but I think over time there are these other things going on in your life and you're questioning, okay, all of a sudden, why do I have an ailment that I didn't have? Or you go to the doctor and then the doctor's like, yeah, we can't find anything.
Precisely.
Because the last time
Yeah.
I went to the doctor was for a physical, and the doctor said, I'm having issues with my knee. So she's like, we can do x-rays and all that, but I bet you we're not going to find anything. And
Huh.
I'm like, I
Yeah.
think so. It's going click, click, click. And then after that, I fell and it's going beyond click, click,
Mm.
click. But um, that's what she's finding, that people are coming through with all of these ailments and there's nothing. They'll run all these tests and can't find it. So anyway,
So those are my observations and experiences, but it is a tool, and I do look for them. I don't look for them as often as I used to.
mhm,
Um, but it is a tool for your toolkit as a healer. So, like, if you don't need the flat braided screwdriver, you don't use it. But it's just like, oh,
right,
any tube attachments? Nope. Okay, move on.
right.
But it is something to look for because they are pretty common.
Mm,
Um, Not real common, but we're only looking for negative tube attachments.
mhm.
We don't care about the healthy one. That's fine. We're only looking for something that's deleterious, that could be
So
harmful.
So I think that is the question. For me, I can sense, but then my logical mind too, there's certain things that happen where there's an attachment, and that is like they usually don't even respond. Now, I think that the possession is different than the possession, because then that's where, to me, it's more clear when there's the possession, is just that whole everything's negative, they don't accept any type of, I mean, you can ask a question, you can say yes, they say no. It's just, and then the response isn't just what you would expect for someone coming in looking
Hmm.
for help, being open and what have you. But then I do see it's a gray, it's like a gray attachment to the body. And the times that I visually have seen them,
Yeah.
one, the aura, I can't even see light coming from the body, and then there's this gray thing, and usually I can see it if they're off to the side. So if they were facing me forward, I don't think I've seen it, but the sense I get, like my gut will go, yeah, something's off here. Like you get the sense the energies just don't align. That's what happens.
Okay.
My
Then,
energy, their
then,
energy,
yeah,
no,
then just keep using your skill set. Just keep analyzing. Keep looking into it. Be relentless and say, okay, nothing's hidden from me. I can see what needs to be seen. I'm a conduit for healing. You know, if you
right?
don't, if you don't accept your power, who's going to?
So I
If
know
you're
what
wait,
Helen, someone said that she had an attachment. So I understand the attachment as opposed to a possession. And that's what I saw too. And it was this
well,
whole,
the attachment is a possession.
right. So that's not how I would classify it before, but
Yeah,
yes, I
yeah,
see the I see I understand the flow.
yeah.
But for her, I didn't see well, it was fear-based because she was afraid she wasn't going to finish what she had
Sorry.
intended. That's all.
How do I get rid of that?
I heard something, but it wasn't clear.
I'm sorry. It's just my phone started going nuts for some reason. And it doesn't
Oh,
even
is it
say that it's a phone
Siri?
call.
Hang up, Siri. Hang
It's
up.
my phone is possessed.
We don't need you, Siri. And now they like in the car or whatever, it's the phone. But Siri has some things to say now. So I'll say, "Oh, thank you, Siri. You're so sweet." And then she'll say, "Oh, it's nice to receive a compliment."
Well, my Echo now has a version 2,
Mm.
and it's much more talky and engaging,
Oh,
and but sometimes if I say, please turn off this heater at this time, it'll pause. Okay, I've created a one-time routine to turn off your heater at 7:30 p.m., which will be one time only that I'm going to do that. And I'm like, stop talking, just do it.
do it.
Don't tell me so much. I don't need all that information. Just
I
freaking
already
do
talked to
it.
a lot of people. They talk to me. You got a lot going on, Dr. J. You don't need a machine telling you to, a computer.
All right. So that's my observations and experiences. So there are common attachment locations. These are not all of them. These are just some of the more common ones. It can be chakras. It can be acupuncture points, glands, organs, the sex organs. It can be the fifth chakra area, neck, thyroid, trapezius. The fourth chakra area, heart, scapula, thymus. Third chakra area, including liver, spleen, gallbladder, stomach. Second chakra area, reproductive organs. It can be the sacral area. It can be the anus, the perineum, acupuncture points in more locations, even the head, even the sixth chakra. Here's some of the common locations
Hmm.
that you might find a tube attachment. You can look in these areas to start. But
And
in
so
other
this
words,
looks like, is this the back side of the person?
yeah. But in other words, give yourself permission, use that feminine principle, allow the information to come to you. Behold the meadow. Just observe and view, and it'll become evident to you. If you try to go looking for it, it's because you're trying too hard. If you're trying
Yeah,
too
I don't think
hard,
I would look for this.
if you're trying too hard, it's going to become very difficult. Forest for the trees kind of thing. I mean, it can be meridian points, it can be chakras, it can be pretty much anything because it's astral. A tube attachment can begin, for example, in the perineum, as I said.
Mhm.
It can then migrate to the sacrum. It can remain in place for many years. I've seen it for more than 20 years in one place.
Really?
And this poor woman was on antidepressants for so many years, just trying to block out the damn pain that she was having, this mental anguish from this form of being possessed.
Mm.
Can there be more than one tube at the same time? Yes. Um, and it can cause many years of suffering. Um, does it matter if you're there physically or not? No, that has no bearing. It doesn't matter. You do not have to be there. It doesn't work that way.
Mhm.
So when you want to find a tube attachment, you can use the feminine principle. You can use beholding the meadow. I'm just sitting on the park bench, just looking, letting it come to me. You can use the snowy field, which is the nuances. You're looking for the little tracks in the snow, the little slight vibrations. Because some people who are very intuitive respond better to the nuances than they do to the big flashing lights. And then what
Mm,
happens to a lot of psychics that are nuance based is they think there's something wrong with them because they didn't see the big flashing lights. Well, but
mm,
that's not how it works for that person. For that person, the way it does work is when they do perceive something that's very slight, very nuanced, because that's the way it's indicated to them. And that works just as well as the other way around.
mhm.
So I say, okay, well, Tanya, breathe all the way down to your belt line. Why? Because I want you to use all seven chakras. I don't want you to just use your heart chakra. Healers who use only the heart chakra run the risk of emotional, physical, spiritual, mental
Mm.
problems. So if I say breathe down below the belt line, feet on the floor, and some students have told me, oh, I say that so many times. Yes, I do. Thank you very much. So when you're using all of your chakras, your effectivity is much greater, but you're safer. Let go, let God. It's not about you. As Morpheus said, I'm trying to free
Yeah.
your mind, Neo, but I can only show you the door. You're the one that has to walk through it. So, in other words, nobody can make you be a great healer. However, you can allow yourself to be the great healer, but not unless you give yourself permission to be so. You cannot force it. You have to open.
Mhm.
You have to surrender. You have to be vulnerable to your power. So, do you have the strength for these levels? Are
Yes.
you are you strong enough to do this? Well, I wouldn't let you take these levels. I think I've told you before, over the years, there have been students that I stopped at level 9. I say, you are not ready to take these levels because their spiritual condition was unstable.
Mm,
And if they were unstable and they went to take the demon, entity, elemental, tube attachment out of someone, they could become
mhm.
possessed.
Right.
Why is that important? Well, because I might not be there when they're doing the work.
Mhm.
So I've had this one student create such a fuss that the hotel we were in Edmonton, the hotel itself banned her from ever coming back to the hotel
Oh.
because she created such a problem. She was so angry with me. She wanted all her money back for the levels. And I said to myself, woman, you're just illustrating my point. You're just illustrating my point. You're emotionally unstable, you're spiritually unstable. I cannot. So I told her, before she got all this angry, I said, why don't you practice for a year and then we'll pick up where we left off?
Mhm.
Nope. Okay. So this is the method of removal. Ready and approach, grasping, distancing, release, a term called etheric jelly,
Mm,
smoothing, cleansing, and post removal.
mm,
So when you apply your skills in these steps, this methodology, this is the safety way. Step by step, you do not skip any steps. You just go one by one until it is etched in your memory. What it does is these steps give your mind a discipline to follow.
Mm-hmm.
It helps your mind to understand step by step the detachment and the removal process. It is the safety way. So, ready and approach means you haven't done anything yet. All you're doing is looking. But it is a due regard for the existence of the two. You're taking a moment to say, you know what? I acknowledge that you're there. I observe that you're there. I know that you're there. And you approach slowly, but also deliberately. Now, grasping, what does that mean? Well, you're using what's called a two-hand approach. And I'll go back to the slides, but I want to stop the share to show you. What you're
Okay.
doing is you're using one hand. Let's say I use my left hand. I
Mm-hmm.
use my hand as the site of where the tube attachment is. It could be anything, could be the perineum, could be a chakra, but I'm just pretending that this is where the tube is attached to that person's being. Whether it's a
Okay.
chakra or the body, doesn't matter. This hand is my grasping hand. This hand is my sight, S-I-T-E, my sight hand. So
Mm-hmm.
when I'm grasping, I take this hand and I approach here like this, and then I begin to grasp the tube. Now you might think, well, Dr. J, that looks a little silly. No, it's a way to help your mind understand what you're doing.
Mm-hmm.
It really has helped me a lot over the years, especially teaching students how to conceptualize what's going on, because then they knew they had to physically go step by step instead of just rushing this. So think of grasping as this is the sight hand,
Mm-hmm.
this is the grasping hand, and I come in here very slowly and I'm going to grasp like this. Now, when I grasp, you're going to feel different size tubes. You're going to feel different power moving through you're going to feel all kinds of things.
Mm-hmm.
But the idea of grasping, and when you feel the moment is right, you're going to start to move your hand away, because once you grasp, what you just did is you stopped the flow of energy going to that other person.
Mm-hmm.
Interestingly enough, sometimes you will get a sense of who it's going to, but mostly for me, I don't, and I don't care. So once I grasp like this, it stops the flow of energy. It's like, okay, something's up. And then at some point, I will distance and I'll start to move my hand apart, but I do so very closely. And I'll go over this again with you. But then what I do is I close my thumb over the sight hand as a way of telling my brain, okay, I'm closing the wound, this open wound. And then what happens as I'm distancing, I'm doing like this. I'm moving my hands apart until this grasping hand is about 3 feet away from this hand.
Mm-hmm.
Then at some point I'll feel this clear Q-U-E-U-E, this clear Q, or C-U-E rather, and then I'll open my hand and it'll ravel back to the person. And then I come back here and I do my clearing and cleansing,
Uh,
and then I have to fill it with something I call etheric jelly. Etheric jelly is just a term. All it means is I'm filling it with neutral energy, neither positive nor negative. Think of it as plasma. You put
mm-hmm.
plasma and and the blood knows what to do with it to turn it into that person's blood. So think of it as I fill this site after I've cleaned it with etheric jelly, and then I smooth over it like sandpaper after I put putty in something. These are just visuals. I
Mm-hmm.
smooth over it and then I'm done. So let me go back to the slides and then you can ask questions as I go back to the slides. So here is grasping. It's a technique of holding the tube attachment so you fill your heart with divine love. And then once you grasp the tube, against your hand like that, it
Hmm.
stabilizes and localizes the energy drain. Now, here's the thing. You'll probably feel resistance at first. Who doesn't want to stop getting free energy? Does the
Mm.
vampire want you to stop them from getting free energy? Think of it as you're about to pull a weed and you're going to test to see how much it takes to pull that weed out of the ground. There's going to be some resistance.
Hmm.
So at first, you pull or tug on it a little bit to get a feel for it. And tube attachments release at their own rate, but I want you to go very slowly. Like pulling I should say, a weed out of the ground, not a tree. But it can have many roots that disturb the ground. So this tube can have many little roots in that person's energy system.
Hmm.
Now, what if a person's laying on the table and you're physically in the room with them? You don't have to touch their body. You can stand
Hmm.
next to the table and you can see me, right?
Hmm.
You can stand next to the table and do this, and that can be the site under their body.
So I see everybody standing up with their hands, in the video out.
Mm-hmm.
Is that how you started like those sessions in person?
Yeah, I mean that's how a lot of them begin to do healing work, as they have their hands spread out like that.
Hmm.
Um, I should probably put more photos in of the actual. I might have a YouTube of how to do this. I'll take a look after we're done here to see if there's a YouTube that I created about this. So let's go over this. In my case, my right hand I use as the tube hand or the grasping hand, and the left hand I use as the sight hand. So as you grasp and tug at the tube attachment, it will begin to separate. But keep your both hands close. Take your time. Breath in, breath out. You know, lower your shoulders. Use all seven chakras. One hand on the tube, and the other hand represents the side of the attachment, which I was showing you when I turned off the share. Now, the next thing after grasping is distancing. So you slowly start to move your hands apart, denoting attachment, detachment, saying, okay, this represents me. I've stopped the negative flow of energy, but now I'm moving these away so that there's no attachment to this person. You close your thumb over the sight hand on your palm, and it signifies you're sealing the energy drain, but it also covers the site of wounding because there can be a tremendous amount of psychic wounding there. This could have gone on for years.
Hmm.
So you bring your hands further apart to continue the detachment of the rule. Now remember, co-creative conscious collaboration. You learn how to do this, you're going to bring people who need it done. You learn how to be a roofer, you're going to find people who need roofing, right?
Right.
So you release. When your hands are spread apart about 3 feet, you slowly open your tube hand, allowing the tube attachment to drift back and reel back to its origin, the owner, whoever that person is. Doesn't matter. And remember, keep one hand on the wound area at all time. I should say one thumb. And then often the one who created the tube attachment is unaware of what happened, but is affected by the removal. And if that person were receiving free energy from another soul, how would they feel if it was suddenly cut off? They'd think something's wrong, but they wouldn't know what's. Most people have no idea what's wrong. But just like that woman's student's mother, she called within 10 minutes. You okay, dear? Is everything all right? Right. You should have seen the look on the students' faces when that woman called. They were like, damn. So, what is etheric jelly? It's a substance that will appear from your tube hand. You can even think of it as Reiki if you like, but it's a neutral etheric jelly that the person will assimilate into their own energy field. It has none of your personality mixed in. It's just a very pure energy, let's say, that fills the site of the wounding that you've already cleaned out. This becomes really crucial when it's a demon or an entity or an elemental, because those entities tend to leave crap behind. Like if
Mm.
you had if you had a teenage child, what does their room look like, right?
Disaster.
So
Yeah.
sometimes it can look awful, right?
Mm-hmm.
So when you get to the point in level 11, let's say you took an entity out of someone, you have to clean that wound out. And
Mm.
I'll tell you what happens to me. It smells. It
Um,
doesn't physically smell,
mhm.
but I swear to you, it smells. So for me, my psychic abilities, sometimes it's awful. It smells like you know what.
Hmm.
Now,
Interesting.
not to all healers,
Hmm.
but to me, in some cases, I take an entity or a demon, it's just the nastiest smell.
Hmm.
So it's going to be different for every healer. So when you open the side hand, then just place your other hand over it like this. Just place your other hand over it and imagine that this etheric jelly is coming from your right hand to your left hand. In other words, going to the wounding site, and let it overfill a little bit. And you allow it to do so because, again, this is a way to visualize or conceptualize that you're cleaning out a wound and you're keeping it in a state with neutral jelly so it can heal with whatever it needs to heal. Again, this is all tricks for the mind to use so that you're going step by step, because in the background, what's happening in the background is your spiritual power is increasing.
Hmm.
You may not think so because your mind is focused on all these steps, but what's really happening in the background is your spiritual awareness is blooming. Now, smoothing is after the etheric jelly, you just kind of go like this a little bit,
Hmm.
similar to sandpaper on putty, right? What you're really doing is just feeling the smoothness of, doesn't matter if it's the heart or the stomach or the chakra, it doesn't matter. It's just meant to smooth the etheric jelly throughout the former site of the attachment. But when you do it slowly, gently, completely, compassionately, because the more you focus on this, the more powerful it will be. Lastly, cleansing. Cleansing is as important as the removal of the tube attachment itself, because the possibility to you is toxicity. The possibility to you as a healer is taking on that negativity. So these two levels becomes incredibly important, that you thoroughly cleanse your client. In other words, you do this, now we're done, like this closing exercise, but you also thoroughly cleanse yourself. Any questions so far?
No, I was just kind of chuckling because you picked the baby for this picture.
Hmm.
Cleanse like you would your newborn baby.
That's right.
Be pure.
Can babies have tube attachments?
I haven't seen a baby with one, but definitely like a 3-year-old.
Yeah. Yes, they can.
So I can't imagine who could have done it, but don't blame the mom.
Right.
Don't blame mom. It could be another force, like you already said.
What about reattachment? Do tube attachments that are removed reattach? No, they cannot. It's not the same one from the vampire, but a new one can appear if that person goes back to their old habits
Right.
or the same toxic associations. What do you expect? Right? They go back to the same thing they were and they got an, oh, gee, Dr. J, I have, well, did you do what I asked you to do? No. Okay. new ones can appear. It's cause and effect. Change the cause, and the tube attachment is unlikely to be recreated. So after removal, now you're done. In post removal, it's important to go over the affected area again to ensure completeness and smoothing the energy. Why? Same reason I say, please do a second assessment, second inventory. It's the same thing. It's a way for you to be thorough. Again, I said, why, Dr. J, we have to go through all these steps? Because you're training your mind. So be gentle, be loving, compassionate, assure cleanliness, leave nothing behind if possible. Sometimes remnants remain. Woman who was a doctor, a chiropractor, I think, she brought her son to me for healing. He's supposed to have a biopsy of his liver the next day. He's supposed to have a tumor on his liver. So the next morning, he's supposed to have a biopsy to see what kind of tumor this is.
Mm-hmm.
So I'm working on him, and I can see the tumor, and I could get it down to a dot. And I was confused. I says, why can't I make the dot go away? And my guide said to me, that's not the tumor. That's the possibility the tumor could return. I said, okay, I can understand that.
Mm-hmm.
So I said, okay, well, do this, and that. And the next morning, he goes into the hospital, and they go to examine the tumor, but there's no tumor anymore. There's nothing to biopsy. But about a year later, she brings him back to me with a new tumor. And I said, well, did you do what I told you to do? No. I said, well, what do you expect? And there's more to that story, but I'll tell you maybe level 11. So sometimes remnants remain or can reoccur because you give them your best advice and they don't follow it. So, what do you expect? After effects. Well, sometimes the person who made the initial attachment or possession will try to reconnect and make a new attachment.
Mm.
And the example is the one I gave you. But it's not the only example. There's other examples of people who have tried to reconnect, reattach, and for the most part, they don't, but some do. Now, when it comes time for your verbal assessment, what do you say?
Mm.
How do you explain to the person an attachment that will help them empower themselves? What if the tube attachment is originating from the of the person on the table,
Mm.
right?
Mm-hmm.
And you take the tube attachment off so that the person on the table is not sucking energy from someone. Could it be a two-way tube attachment like codependence? So there's an art form every healer develops in making assessments, as you have learned in the last almost 2 years. Thank you very much. Since May. And there's an ethic involved in how you explain what it is you're doing. Like you can't just say to anybody, I took a tube attachment off that was a vampiric attachment. There's ways that you can frame it. This is, well, look, there was an energy drain, and this is what I did, and I helped to remove that energy drain, and hopefully you'll be feeling better very quickly. And sometimes that's enough. You have to be careful not to over explain something to the extent that the person freaks out and says, I have a what? Because sometimes people have a sometimes people have a very orthodox religious background, and
Right.
they're not framing it in that way.
Mm-hmm.
So what kind of suggestion would you give that person? Just say, well, when you maintain your spiritual practices, also maintain your moral and ethical standards. Maybe something like that. But maybe that woman was in a codependent relationship with her mother, and the mother was just used to sucking energy off of her own daughter.
Hmm.
So you have to be really thinking about what you're going to say and how you say it to that person, because they may not be capable of understanding a tube attachment or a demon or something like that. You might just want to say, look, I did some balancing, just remove some energy that was leaking away from you. You have to be artful. And so, there's nothing wrong with being clever if it's in a good way.
Hmm. Like
And
taking your sucker test.
yeah, well, did I say cleanliness? Well,
Hmm.
stay in balance, clear yourself of the attachment to the outcome, and be centered and calm. Enjoy this work. This is meant to be joyful. It was not meant to be stressful. So this is level 10 that we remarkably covered in only an hour and 15 minutes. Usually it takes 2 to 3 hours to adequately cover this level. But I think sometimes when it's a one-on-one like you and me,
Hmm.
for some reason maybe it goes a little more quickly. I don't know.
Well, I'm following. It's these aren't like the attachments aren't. It's not a new concept, but I love it that you do have. And this was I was looking forward to it, your systematic approach. Because what I've done in the past with the possession is use holy water and then like say a
Yes.
prayer, guardian angel
Hmm.
prayer, encourage them to say it
Hmm.
and use holy water for both them, myself. I remember one time I was guided to drink the holy water myself,
Hmm.
uh, just for protection. I think it was part of the cleansing. It was not something I would recommend anyone would do. I was just told to do it.
Yeah,
Uh,
that's fine.
and I didn't feel like there was an attachment. But yeah, I totally
Hmm.
get it because I told you the reason why for me wasn't I didn't want to dive any further before meeting you was because of it's this exactly. But I do feel pretty good about it, and just with the people we've worked with, being able to see it at this point.
Hmm.
Like I said with Cindy, so let's see what she says on Monday, how she's doing, and then to
Well,
really, I think, wrap that up in terms of the follow up.
I, yeah, well, I hope she does come on Monday. I mean, she said she would, but we'll
I
see.
think she will. And if she doesn't, well, you already know. If she has a an attachment, then sometimes the resistance there. But it's
Mhm.
interesting, it was on her. I didn't the image I got, when I'm thinking about it was like an image on an image, right?
Mhm.
But we'll see because now I'm going back to the memory as opposed to it's happening right now. So let's see what we get. I just feel like it would be a great ethical thing to do is to follow up with her, and then
Yeah.
it's great for the training because that's what
Yeah,
you
and
always ask.
I'm glad we did that. So I'm glad she is coming. Then that gives you a way to say, okay, some time has passed. Let's see what's what. You can review your notes, and
And that's what I was
you and
going
I
to do.
can have a great conversation after you work on her.
And then look at those last questions. That's what I'm going to do to prep for that
Hmm.
session. So
Hmm.
I think she's coming. I think when I saw the email, it felt
Cool.
like yeah, that she wants to be part of this.
So now, this May will be 2 years since you started this training.
Hmm.
How are you feeling so far?
I'm feeling pretty good, but now I'm looking at work and it's that balance in life. But spiritually, I'm feeling really strong. Physically, I think it's the weather too. It's pretty, it's been cool and overcast.
Hmm.
And then we had a little drizzle, but yeah, the bigger picture is just real life. This is the end of the fiscal year. I already told you the last time.
Yeah, yeah.
So I was able to get the 1099s done. So I'm just, prioritizing. and moving through the list in terms of spirituality. Like I said, I'm feeling really strong. I was even not physically feeling that well because my husband was sick for so long and not sleeping well. And
Is he better
so,
now?
yeah, he actually is better. So I think he has some type of virus and it had
Okay.
to naturally work itself through. But he has asthma. And the thing is, he decided to teach for this spring, well, it's semester. So I did, this
Hmm.
is considered spring for them. Um, so he's doing that, which is kind of crazy, but because we were invited to a wedding in Guatemala
Oh,
in
when?
July, but
Ooh, oh.
I know I'm praying that my knee holds up, but we wanted to stop, make a
Well,
couple trips.
it depends on where you are. Like if you're in Lake Atitlan, you're up in elevation, so it's not going to be like if you're down in Kiowa.
I tell you, if I
You
can
gotta
find,
love humidity.
I actually do love humidity, but he doesn't.
Just
So
I'm
me, I
just
feel like my hair, my body, it's
yeah.
moisture. You know,
Well,
I love humidity, but
July will be interesting for you.
hmm so
So are you feeling like our progression is okay?
oh yeah, I think because we've been going slow, and it's because life happens, and just completing everything. Yeah, I feel really good about it.
So,
I was
excuse
like
me.
almost 2 years. What? Oh, Dr. J.
May, May 2024.
So we're making pretty good progress. So,
Hmm.
I think if I keep continuing to work on those student practice forms and having those done in a
And,
timely manner, that
and
helps a lot.
and levels 10 and 11 have been taught over a weekend, so we can jump right into level 11 when
Hmm.
you're ready. And then use this level in all of your work now. Just say, okay, I'm going to look for tube attachments. I'm looking
Hmm.
for tube attachments. I'm looking for tube attachments. Okay, there aren't any. Fine. Out of body. No. Okay, fine. On to the next
Hmm.
thing. But always the aura, always the chakras. Always, always, always. What's the dominant chakra? What's strong? What's weak? What's excess? What's deficient?
Hmm.
Always, 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 always. Because that's the center of consciousness. And the more you use
And
your
with the
chakras, the more you're going to
chakras,
see.
what I got from Cindy was she had issues in most of those chakras. Physical problems were presented.
Mhm,
So I think that is a red flag when the person is just it's like deteriorating. And then at the end, I just felt like that she was
mhm.
being drained, her life was being sucked out of her. So,
Well, isn't that fortunate for her that she brought you into her life? What
well,
about that?
very hopeful, praying to God, keeping a strong mind and spirit.
Yeah. Okay, anything else before we close?
Nope, that's it.
Have yourself a glorious weekend. Let me know when you want to schedule for your level 11, and I will look forward to seeing you on Monday night.
Okay. So for student practices, should I split it between the two, or do you need 10 for 10?
No, levels 10 and 11, you'll need
Okay.
10,
So you
10
need five
RPs
and
and
five.
yeah, 10 and 11,
Okay.
10 RPs and one detail.
Okay.
12 and 13, 14, 15, like that.
Well, I say let's schedule something for next Friday if you're open.
Okay, let me stop the recording here and say thank you and bless you.